All right, so get this. Imagine you could like predict someone's health just by looking at their teeth. Pretty crazy, right?
That's wild.
But that's actually what we're going to be diving into today.
That's awesome.
We are taking a deep dive into a 2025 study
Okay.
from the Journal of Evidence-Based Dental Practice.
All right.
It's called The Correlation Between Oral and General Health-Related Quality of Life in Adults, a systematic review and meta-analysis.
Wow, that's a mouthful.
Yeah, it's a long one, but let me tell you, this isn't just about brushing and flossing. This is about how your mouth can basically be like a window into your overall health.
It really is remarkable. We often think about oral health and overall health as like these separate things,
Yeah, totally.
but the research is really showing us just how connected they are.
Exactly. And to help us like decode all of this today, we have an expert
Oh, boy.
who can really connect the dots between dental health and the bigger picture of a person's well-being.
Well, I'm happy to be here.
Awesome. We're glad to have you. So this study that we're talking about focuses on this link between oral health and overall health.
Right.
But they use these kind of complicated terms, OHRQoL and HRQoL.
Yeah.
Can you help us break that down? Like, what are those all about?
Yeah, sure. So OHRQoL stands for Oral Health-Related Quality of Life.
Okay.
So think about it this way. Imagine being able to eat anything you want, without your teeth hurting. That's good oral health impacting your quality of life.
Totally. Yeah, that makes sense.
And HRQoL is similar, but it's broader. It stands for Health-Related Quality of Life.
Okay.
So think about being able to walk up a hill without getting out of breath. That's good overall health, contributing to your quality of life.
Right. I'm with you.
Yeah.
So basically, this study wanted to figure out how connected those two things are.
Exactly.
How much does our oral health actually affect our overall well-being?
Yeah, they wanted to know if there was a correlation, and if so, how strong it was. And to do that, they did what's called a meta-analysis, which is basically like looking at a ton of studies all at once to get the most reliable answer.
So they crunched the numbers from all those studies.
Yes.
Drumroll, please. And what did they find?
They found that the correlation between oral and general health was 0.41.
Okay, so 0.41.
0.41.
Decode that. For me, what does that actually mean in terms of like how connected our oral health and overall health are?
A correlation of 0.41 is considered a medium correlation.
Okay.
It means that there's a definite link between the two. It's like they're partners in a dance.
Okay.
They influence each other, but they don't always move in perfect sync.
Oh, I like that analogy.
Yeah.
So you're telling me that by taking care of my teeth, I could be reducing my risk of like heart disease or something?
Well, it's not quite that simple, but you're getting the idea.
Okay.
The study doesn't tell us exactly why this link exists, but it does show us that there's a pretty strong connection.
Okay, so maybe hold off on canceling your gym membership just yet. But this is still huge, right? We're talking about a pretty significant connection between what's happening in our mouths and our overall health.
Absolutely. And it's important to remember that this wasn't just like a small study.
Yeah.
They looked at data from over 6,000 people.
6,000 people. Wow, that's a lot of teeth.
A lot of teeth.
So these studies were done in 9 different countries.
Yes, 9 different countries.
So it seems like this connection between your mouth and your overall health isn't just some fluke.
Yeah.
This is like a universal truth.
Yeah, it appears to be.
Wow, okay, now I'm really paying attention. So what does this mean for me when I go to the dentist?
Well, that's where it gets really interesting. This research has huge implications for the way dentists approach patient care.
Okay.
We're talking about a potential revolution in healthcare where your dentist becomes a key player in keeping you healthy overall.
All right, now I'm really intrigued. Tell me more.
Think of it this way. Your dentist is already looking inside your mouth, a place that can reveal a lot about your overall health. With this new understanding, they're in a unique position to spot early warning signs for all sorts of conditions.
Wait, so you're saying my dentist could be like the first line of defense against diabetes or heart disease?
Mm-hmm.
How's that even possible?
It's all about recognizing those connections. Like, let's say your dentist sees signs of gum disease, which is inflammation of the gums.
Yeah, I've definitely had my fair share of lectures about that.
Well, it turns out that gum disease isn't just bad for your teeth. Research has shown that it can actually be linked to other inflammatory conditions throughout the body.
Oh, wow.
Like heart disease and diabetes.
Hold on, you're saying that like the health of my gums could be connected to my risk of heart disease? Are you serious?
I am serious. It's all about inflammation. When your gums are inflamed, it can release inflammatory substances into your bloodstream, which can then travel to other parts of your body.
Oh, wow.
And contribute to problems elsewhere.
I never thought about it like that before. So how does this, like, actually change? What dentists do, I mean, are they going to start checking my blood pressure now too?
Maybe not blood pressure, but
Yeah.
they're definitely going to start taking a more holistic approach to your care.
Okay.
They'll be looking for signs in your mouth that might signal a bigger health issue,
Right.
and they'll be talking to you about your overall health history and any potential risk factors you might have.
So they're basically becoming like health detectives using clues from my mouth
Yeah.
to figure out what else might be going on.
Exactly. And they'll be working more closely with other healthcare providers like your primary care doctor
Right.
to make sure you're getting the best possible care for your whole body, not just your teeth.
This is starting to sound like a whole new era of dentistry.
Yeah.
What are some specific things that dentists might be doing differently based on this research?
For one, they'll be asking you more questions about your overall health.
Okay.
Things like, do you have a family history of heart disease, or are you currently managing any chronic conditions?
Right.
They'll also be paying closer attention to any signs of inflammation in your mouth, even if it seems minor.
So even if I just have a little bit of bleeding when I floss, my dentist might see that as like a potential red flag.
Absolutely. They'll want to dig a little deeper and figure out what might be causing that inflammation. It could be something simple, or it could be a sign of something more serious that needs to be addressed.
That's kind of scary, but also really interesting.
Yeah.
It sounds like dentists are going to need a lot more training to keep up with all of this new information.
You're absolutely right. This research really emphasizes the importance of ongoing education for dentists.
Yeah.
They need to stay up to date on the latest findings about this connection between oral health and overall health, and they need to learn how to integrate this knowledge into their practice.
It's like they're not just dentists anymore. They're like oral physicians.
All right.
So what does this mean for patients? What should we be doing differently now that we know all of this?
First and foremost, don't underestimate the importance of good oral hygiene. Brushing, flossing, and regular dental checkups are more important than ever. They're not just about keeping your teeth white and shiny, they're about protecting your overall health.
So all those times my mom nagged me to floss, she was right.
It sounds like she was onto something. But beyond that, be open and honest with your dentist about your overall health.
Okay.
Share any concerns you have, any conditions you're managing, any family history of health problems. The more information they have, the better they can assess your risk and provide personalized care.
Okay, that makes sense. But what about people who like don't have dental insurance or can't afford regular dental care? It seems like this new approach to dentistry could make it even harder for them to get the care they need.
That's a really important point, and it's something that needs to be addressed. Access to affordable dental care is a huge issue,
Right.
and this research just highlights how important it is to make sure everyone has the opportunity to take care of their oral health.
So it sounds like we need some like big changes in our healthcare system to make sure everyone can benefit from this new understanding of oral health.
Absolutely. We need to find ways to make dental care more accessible and affordable for everyone,
Right.
so that we can all reap the rewards of a healthier mouth and a healthier body.
This has been a fascinating deep dive so far.
Yeah, it has.
We've gone from thinking about dentists as just tooth fixers to seeing them as like key players in our overall health. It's a pretty exciting shift.
It really is, and there's still so much more to explore.
We'll hold that thought because we've got more to cover. Okay, so we're back and ready to like dive even deeper into this whole connection between oral health and overall well-being.
Right.
You know, we've talked about the research, we've talked about these like exciting new possibilities for dentists.
Right.
But now I kind of want to get into like the stuff that keeps scientists up at night, like the mysteries that still need solving.
Yeah, I love that you call it stuff that keeps scientists up at night. It really is a bit like a detective story, isn't it?
It is.
We've got the clues, we've got the connection, but we're still trying to figure out exactly how it all works.
It's exactly. So like, what are some of the big like unanswered questions that researchers are tackling right now? What's like the next chapter in this dental detective story?
Well, one of the biggest mysteries is the why behind this connection. We know that oral health and overall health are linked,
Uh-huh.
but what's the underlying mechanism that explains it?
Right. We talked a bit about inflammation earlier. Could that be the key?
Yeah, inflammation is definitely a major player. We know that chronic inflammation is linked to so many diseases, from heart disease to diabetes to even some types of cancer.
Right.
And since gum disease is basically inflammation of the gums, it makes sense that it could be contributing to those problems.
Right. So the inflammation in your mouth could be like a tiny fire that spreads throughout your body and causes like trouble elsewhere. But you're saying that inflammation might not be the whole story?
Exactly. There could be other factors at play, like the specific types of bacteria that live in our mouths.
Okay.
We know that our mouths are teeming with bacteria, and some of them are helpful, but some of them can be harmful.
So it's possible that like certain types of bad bacteria in our mouths could be contributing to those like bigger health problems.
That's one of the theories researchers are exploring, and if that turns out to be true, it could open up some really exciting possibilities for treatment.
Oh, really?
Yeah. Imagine being able to target those specific bacteria with personalized therapies or even just dietary changes.
Wow. So my dentist might one day be prescribing me like probiotics or telling me to cut back on sugar to improve not just my oral health, but my overall health.
It's definitely within the realm of possibility, and that's what makes this research so groundbreaking. It's not just about teeth anymore.
Right.
It's about understanding how our mouths play a crucial role in the health of our entire body.
This is truly mind-blowing stuff. So what can our listeners do to kind of stay ahead of the curve? Any advice for those of us who want to like optimize our oral health for the sake of our whole body?
Well, first and foremost, don't skip those dental checkups.
Yeah, for sure.
Your dentist is your partner in this journey, and they can help you identify any potential issues early on.
Right? Prevention is key. But what about like those of us who might be genetically predisposed to certain oral health problems? Is there anything we can do beyond like the usual brushing and flossing?
That's a great question, and it's an area where research is still evolving.
Okay.
But one thing that seems to be emerging is the importance of diet. What we eat can have a huge impact on the balance of bacteria in our mouths.
So you're saying that what I eat could actually be feeding like the good bacteria or the bad bacteria in my mouth.
It's true, a diet high in sugar and processed foods tends to promote the growth of those harmful bacteria, while a diet rich in fruits, vegetables, and fiber can help nourish the beneficial ones.
Okay, so another reason to eat our veggies, but beyond diet, is there anything else we can do to kind of take care of our oral microbiome, that community of bacteria in our mouths?
Research on this is still in its early stages,
Okay.
but some scientists are exploring the potential of things like oral probiotics or even fecal microbiota transplantation to help restore a healthy balance of bacteria in the mouth.
Fecal, okay, now that's a topic for another deep dive, but
Yeah.
the takeaway here is that the future of oral health is about so much more than just teeth.
Exactly.
It's about understanding this like complex ecosystem in our mouths and how it impacts our overall health.
Absolutely. We're just scratching the surface of what's possible, and I'm incredibly excited to see what new discoveries emerge in the years to come.
This has been an incredible deep dive into the world of oral health. And I think we've all learned a lot about how crucial our mouths are
Yeah.
to our overall well-being. It's amazing how much we're still learning about the human body.
It really is. It's a fascinating field.
It is.
Yeah.
And to all our listeners out there, remember, pay attention to what's happening in your mouth and don't underestimate the power of good oral hygiene.
Yeah, great advice.
It might just be the key to a healthier, happier you.
Thanks for listening, everyone, and thanks for joining us.
It's been my pleasure. Thank you for having me.